Hello, everybody. It's December 22nd, 2020. This is Gary Pace, the Lake County Public Health Officer, and I'm here today to give the coronavirus update for Lake County. We are in a situation where the number of cases is increasing dramatically. We now have a total of over 1,500 cases since the beginning of the pandemic in Lake County. We have 238 people that are actively infected with COVID, which is by far the highest number we've ever had. We've had a total of 22 people pass away. We have a few slides where I'm going to show just how fast things are increasing in California and also in Lake County. This first slide here on the right-hand side shows the test positivity rate in California. So this shows the number of tests out of all the tests that were taken that are positive right now. And currently in California, it's over 12%. In Lake County, it's been anywhere from 8 to 11% over the last couple of days. But what we're seeing is as this curve goes up here, we'll see an increase in cases and then an increase in hospitalizations a little while later, which is how we project into the coming weeks what we're going to be able to expect. This line seems to maybe be flattening down a little bit, but we have some new information from the last couple of days that it looks like it's going back up again. But that's really what we're watching to see. If that starts flattening down, then we feel like we're going to have some optimism about the coming weeks. So for the next slide here, on the left-hand side, this is the total number of cases in California. And as you can see, this curve is going up, up, up over the last couple of weeks. This is almost for sure a reflection of what happened over Thanksgiving when people were out and about and seeing people. This curve on the right, again, is California, but this shows the number of people that are now in the hospital. And it's the same kind of general curve as in the previous slide, but it's just a couple weeks later. So the cases go up, and then a couple weeks later, the hospital rates go up. And you can see neither of these curves are starting to flatten down at all. They're continuing to go up, and we don't really know how high they'll finally go. This next slide here on the left-hand side is, again, all of California, and it shows the total number of ICU beds that are available. So as we go along here in June and through the summer, the ICU beds were 4,000 beds or something were available. Then it dropped down here in August to about 2,500 beds were available throughout the state of California. And now it's dropping down, down, down. And so into December, we're down to a little over 1,000 beds available. The main issue around this is what we're following statewide to just see how well people are, what the hospital capacity is going to be moving forward. Are we going to be able to take care of all the sick people that we need to be able to take care of? And the projection is that we're going to be seeing something like 1,400 people needing ICU beds in the coming weeks, and there's only about 1,400 ICU beds available. So the concern is that we're going to run out of ICU beds through the whole state. Right now, there are certain regions that are already running out of beds, especially down on the border, and LA is getting very close. But there's still some ability to transport people around. But in the coming weeks, that's probably going to, we're anticipating that the number of people needing hospital beds is going to continue to increase. And of course, the number of beds doesn't change much. This slide on the right is the number of deaths in California. And you can see that that curve is continuing to rise, just like the hospital curve and just like the case rate curve. It's higher now than it's been any other time during the pandemic in California, the total number of deaths. We had something like almost 250 deaths yesterday that were related to COVID. This is my last slide. This is Lake County. Basically, this is what we call the epi curve, and it shows the number of new cases by week. And as you can see, we had a peak back in mid-September. There was an outbreak that was going on, and then that got better. And now we're going up and up and up. And we're up at this very high number here at almost 200 cases in the last week. And now some more tests are coming in, so it's over 200 now. And again, we don't know how high this is going to go. So the concern here is that as the case rate goes up, you could see that the hospital rate also rises, and then the death rate rises after that. So that's what we're looking at in the coming weeks, and that's what we're particularly concerned about. So we'll stop share now. So just a little more data about what's going on in Lake County. Our current case rate is 31.5 per 100,000. And when you go over 10 per 100,000, that's when you go into the purple zone. So we're actually 3 times that number now in the current case rate in Lake County from where we were when we went into the purple zone just a few weeks back. The positivity rate, the test positivity rate, like I said, is something like somewhere between 8.5 and 11 now. It's changed a little bit over the last couple of days. Southern California, it's about 14%, and this is quite high, and it really lets us be concerned that there's going to be a bunch more cases coming down the road. The ICU capacity in the Northern California region, what we're calling the Rancho region, is remaining stable at about 28%. So it's staying about 25 to 30% in our region, whereas pretty much all the rest of the state, it's 15% or below. In Southern California, it's down into the, under 5%. Though, while we're saying that, yesterday, the available ICU beds in Lake County was only 1 out of the 8 regularly set up beds. So, we tend to transport people out to other areas. We are still able to transport out, but there has been some, slowdown and some backups in the emergency room and in some of the transports out, but we've been able to continue moving. So we're not in a crisis situation now. All of this conversation I'm showing with the graphs and everything is really to try to give a sense of what we think might be coming in the coming weeks. So the current outbreak situation around the county is we do have a tribal outbreak that's been happening over the last month or so, and now the total number of cases is a little over 100. It seems like this outbreak is slowing down now, and we're not seeing many new cases out of that. The nursing homes, one of them has a pretty significant cluster of cases. The others are okay at this point. The homeless shelter, one of the shelters had an exposure, but we just tested both the shelters recently, and there are no new cases that we've been able to pick up. The schools and businesses are all having little outbreaks at this point. The schools are all closed now because of the holidays. But, the general idea is that the virus is spreading throughout the whole community. So it's not just in one area like we were seeing in the past, but now it's popping up everywhere. And probably most of you know somebody who's positive, or at least somebody who's had contact with somebody who's positive, because the different businesses, the different workplaces are all reporting cases and trying to figure out and sort of scrambling on how to deal with them. One of the things that we've seen is that 75% of the total cases now are showing up in either Lakeport, Kelseyville, or Clear Lake. So that's, of course, where most of the population is, but it does seem to be where some of the positive cases are clustering in those areas. So, the question is what's the response that we're doing in the county, and how do we think it's working, and what else do we need to try to do to put into place? A big piece of what we're starting to focus on now more is our communications and public health education. We've been trying to talk to the public a lot lately, well, through the whole time, about masking and social distancing, and, been varying degrees of success. But now we're starting to try to expand and get some of our community partners to help us with the messaging. We Hope Rising is starting to do some messaging around COVID. We're starting to get a team that's going to be working some with social media and some of the other ways of getting the word out. And we have a couple grants that are out to try to get some messaging and outreach to the Native American community and to the Latino community, because the communication needs are particular there. So we'll see how that goes, and please let us know if you have ideas or if things seem to be working or don't seem to be working. The testing situation is changing quite a bit now. So we want to definitely support ongoing testing around the county. The state contract with Verily, who was the company that was putting up the stand-up testing sites that we've had going for the last 6 months or so, the state contract has ended and it's shifting to a company called OptumServe, which is really around most of the rest of the state at this point. We were lucky in that we were working with Verily because we were able to get these mobile test sites that were up and able to put in 4 different sites around the county. This Optum site, we're only going to be able to have 2 sites, and they're going to be indoors. It won't be a drive-through anymore. This is going to start on January 4th. So 2 weeks from yesterday is when the first OptumServe site is going to be. We're going to have them in Lakeport on Monday, Friday, and Saturday. They would be 12 hours long from 7 to 7, and it should be at the Lakeport Community Center down the old Bank of America building. You can walk in. You don't have to have an appointment. You can get an appointment online, or you can get an appointment by calling. So all these are going to be available. It should be much more accessible in terms of the hours and in terms of the ability to get to the site. The one at the other end of the lake is going to be at the Lower Lake Town Hall. It'll be on Tuesday, Wednesday, Thursday, the same hours, 7 to 7, and the same setup in terms of getting an appointment. So we're still in the process of making the final arrangements. There's been a lot of last minute shuffling around, but we think this is going to work out really well and allow much more testing in the community. So until that point, so the rest of this week, today is Tuesday, so we're going to have one more testing site tomorrow at in Lakeport, and then next week we're going to do Monday, Tuesday in Clear Lake, Wednesday in Lakeport, and then because of the holidays, we won't be testing Thursday or Friday either week. Also, if people are interested, Rite Aid apparently is starting to do some testing, so you can try to track that down on through the Rite Aid internet webpage and see if you can get on there. So if you're having problem accessing some of the testing, you can contact us at Public Health. We will be having our phone line open Monday, Tuesday, Wednesday this week, Monday through Thursday next week. So we will still be answering questions or emails or phone call questions if you have anything you need. So a lot of times people are wanting to know about what's going to happen if the hospitals do get overwhelmed. We're doing a lot of planning. We're meeting regularly with both the hospitals, with the clinics, and with the ambulance services, and with our whole region. The state has put up some extra beds in Northern California. They're trying to set up 20 extra beds in Chico, 20 extra beds in Marysville, and 20 extra beds up in Redding that will allow if the beds that we do have already set up get overfilled, then we can transport people up there. Each of the hospitals also has a plan to be able to expand somewhat locally and in the region. But the problem is staffing. It's just hard to get more staff, more trained staff that are available to do these things. But we're working on the local level, on the regional level for that. And then the state is also trying to set up these extra beds. The enforcement question. So really the big thing that everybody should be doing now is trying to stay at home. We're in the purple tier, which means indoor dining, indoor church services, those kind of things. And most indoor activity is very limited or not permitted. You can go into retail stores, but it's up to 20% capacity. And we are not in the whole shelter and the stay-at-home order that's in the rest of the state yet. But if we do drop down below 15% of the hospital ICU capacity, then we may go into that. But people know that they probably should be staying home now and not going out and about. It seems like a lot of the transmission that we're seeing is within families or within social gatherings that people are doing, especially around Thanksgiving and now with Christmas and New Year's coming up. We want to really encourage people not to go outside of the home if at all possible, not to go mixing with other families, especially indoors, especially around meals where you don't have your masks on. That's where a lot of this seems to be spreading, and that really what we think we're seeing around the country is based on this. So if you can stay home, not see other folks, and kind of just have this be a different kind of Christmas this year, That's really what we're recommending. If you do feel like you must go see somebody, your family members or something, it's much, much better to stay outdoors, limit the amount of time you're seeing them, and try to keep a mask on and keep social distancing. What we're seeing is the amount of virus in the community is very high right now. So the things you could get away with doing in earlier parts of this, in months past, you're really not going to be able to get away with now without coming in contact with the virus and potentially getting infected. We do have the job posting up for the enforcement officer that's going to help with education and trying to help some of the businesses come in line if they're not in line. And now Cal OSHA is also has some new guidelines out about workplaces being safe, and if there is an outbreak in the workplace, that Cal OSHA should be involved in the discussion. So it's all a kind of a moving target right now. The vaccine is the kind of the last thing I really wanted to talk about. Last week on Thursday, we got our first shipment of the Pfizer vaccine. We got 975 doses into the county, and we're focusing on getting those to the acute care hospital so that they can vaccinate their staff and their clinical staff and their support staff to keep the hospitals running during these coming months. I'm very, very concerned about what's going to be happening to our medical infrastructure now for the next probably 8 weeks or so. And I think it's essential to get the vaccine to these folks that are going to be doing what they can to help people that get sick and to help keep us all healthy. We're also going to be vaccinating the medical emergency responders. So the EMS folks that drive the ambulances or come out if you call 911, they're going to be protected too. We're setting up some vaccine clinics for them in the next week or so. So we're, the vaccine is really focused right now on trying to just keep us able to get through this outbreak period here as safely as possible and to keep the hospitals and the ambulances running. The next tier of people that would be available will be the nursing homes. And it looks like the pharmacies are going to be helping us do that. They're supposed to be starting to get shipments next week, and we can protect the staff in the nursing homes. After that, that's the next tier after that, which will be some of the other medical settings, the outpatient clinics and things like that. And once we get everybody covered in the first tier, then we'll go down to the next tier and start dealing with that. We're getting a lot of questions from people about which tier they fit into. And really right now, all the vaccine is going to be going to the acute care hospital people, the EMS folks, and then the nursing homes. Once we get those covered, then we can start looking at the next level. The state is taking some of the CDC guidelines, which you may have heard about last couple of days, about kind of prioritizing essential workers and farm workers and food service workers and also the folks over 75. The state has a group that's working on putting all this together and setting priorities, and they're going to factor those recommendations into it. And we should be hearing about that in the next couple of days. I think that's probably so the state did have one, they were thinking that they're going to get a total of 1.7 million of the vaccines into the state by the end of the year. So with one more week, a little over a week, we should have a total of 1.7 million doses of the vaccine in the state. We'll have something like, I don't know, between 11 and 1,500 doses probably in Lake County that, again, is going to be focused on the healthcare worker staff. When it will be spreading out to the essential workers and the clinical staff in the outpatient clinics and things like that is probably in the next month or two. We're not really sure how much we're going to be getting after this round. It's a little, it's kind of a changing numbers that they give us, but we should be hearing pretty quickly about how much we're going to get, and then we can kind of get the priorities in place and start getting some timelines out to people. But we intend to follow the state recommendations about this so that it's predictable and so people can kind of know. And so that if you're in one of the tiers, you can be sure that you're going to get it before the next tier starts getting some of the vaccine. So Some folks have had some concerns about the safety of the vaccine. At this point, we're seeing really good things. The people that have been getting it may get a little bit of a sore shoulder or a little bit of a muscle ache, a little bit of a fever, but it doesn't last very long, and they seem to be able to keep working and doing okay. There have been some reports of rather severe reactions around the country and around the world, but it's been pretty rare. And those are folks, it seems like, mainly that have had severe allergic reactions to vaccine in the past. And I think if you fall in that category, you want to be sure to at least have an EpiPen when you go get the shot, and kind of let the person that's giving it to you know that you've had some reactions in the past. But really, I think this is one of those things that the risk of the disease is much greater than the risk of the vaccine from everything we know at this point. And I plan to get one as soon as I possibly can. I'm not in the first tier, but hopefully I'll be able to get one fairly soon here. So overall, I think, just to kind of sum up where we're at, it's a very, very difficult time right now. I think we're entering into kind of the phase that we've been concerned about the whole time of this pandemic, which is this deep part of winter. You know, we just had the shortest day of the year yesterday, and now we're moving into this time where we have a lot of the virus around. People are indoors more. We're going to be having the holiday period, and the hospitals are running out of room. So where this ends up, it looks pretty concerning to me right now, and I really hope everybody can do everything they can to stay home and protect their families and protect their friends by just sort of withdrawing from a lot of interaction right now. I think it's not going to last that long, a couple months, and we should be on our way out of this and into a whole new time and kind of ability to interact and kind of understanding what our priorities are. The vaccine is going to help that a lot. This really adds a lot of light at the end of the tunnel for us. And by, within the next couple months, we're going to roll it out as fast as we get it and as fast as we can, and just kind of try to be predictable and get it to the people in a kind of a staged practice of having the highest priority people get it first and then moving down the list. But so just please take care and have a good holiday. But this is probably going to be a different one for most of us than it usually is. But I think it's really, I want to really encourage people to be as safe as possible and just take extra precaution this year so that we can all be around next year to enjoy each other's company and have a more normal time together. So thank you very much and have a happy holidays.